All right, y'all. In this video, we'll be going over your knee internal, external rotation, PAILs, rails. All right, so fairly simple setup. Here's a good option for you. So assuming you've done your knee cars already, if you haven't, please pause the video and do so. You might want a wall to lean up against for comfort. Not totally necessary. And as far as the position of the other leg that you're not targeting, whatever's comfortable for you. All right, so what we're going to do is I'm going to be targeting this right leg here. So as we know, the knee flexes and extends, right? And today we're going to work on rotation, external rotation, internal rotation of the tibia. So most people are missing internal rotation, right? And we will get there. The lower hanging fruit is external rotation, a little easier to get to as well. So I'm going to pull my tibia into its passive external rotation. Try not to have the hip get involved, right? Try not to fake it through ankle movement, right? So externally rotating the tibia. Try and get into your full end range there. The outside hand is coming over and grabbing the foot to be the block that we're going to PAILs, rails against, or at least PAILs, right? So maintaining that externally rotated position, you might feel some sensation on the inside knee there. Again, we're not looking for pain, but some sort of deep stretch or capsular sensation. You may not feel much at all, which is totally fine. Yep. So I'm hanging out here for, again, as we know, 1 to 2 minutes. And I'm just going to chill because I'm going to be doing this with you, right? So we're hanging out here, trying to pull it into its full externally rotated position. While we wait, I'll kind of explain the PAILs rails. So what this looks like is PAILs, progressive angular isometric loading, as we know. I'm going to try and engage this knee inside stuff, if you will, squeezing it so that the tibia is rotating inward. My hand is going to meet my foot's resistance as a block, right? Ramping up 10% to 100% effort. 3, 2, 1. We're not doing it right now, just explaining it. 3, 2, 1 when we flip, trying to feel that outside stuff of the leg and knee engage to try and rotate further into external rotation. All right. So now that we've been here for about a minute or so, we can execute a good, safe PAILs rails. So you can place the other hand on the inside of the knee so that when you engage in internal rotation, you should feel the tissue here start to engage and light up. All right. So hand goes here. 10% effort. I'm trying to rotate my tibia inward. Hand is meeting the foot's resistance. 10%, 20%, 30, 40, 50, 60, 70, 80, 90, 100% safest max effort drive for 15 seconds. Go, go, go. This is difficult, especially rotation of the knee. There's not much happening here, but I know that it's trying. Holding for another 5, 4, 3, 2. Hand block stays here. Externally rotate as hard as you can. Foot and tibia away from that block hand. That hand is not helping you. Into internal rotation. Drive, drive, drive. Squeeze, squeeze, squeeze. You should feel this outside stuff really going for it. If you want, you can take your hands and kind of gently try and push it into internal rotation to give you some more feedback as you fight for more external rotation. Drive, drive, drive. 5, 4, 3, 2, 1. Catch and allow it to get into a new passive end range. All right. So that's tibial external rotation. Tibial internal rotation is just the opposite direction, right? So before I get into that, something that helps me a lot is as I'm driving in my rails contraction, trying to get deeper into the stretch. Again, what I said there was I take my hands and I pull it, my lower leg, gently into the opposite direction. And that helps me feel the sensation of the musculature that's trying to work into the rails contraction. All right, so pulling my knee into, or my tibia into internal rotation, which for most people won't be much. Try not to get my hip involved. Internal rotation, inside arm comes across as the block. Outside arm stays. I'm kind of shifting onto my lateral or my other hip here. Hanging out here. And again, to reiterate, this hand for both external and internal, whichever hand it is and whichever you're working, when we rails contract, so when we flip it to the 100% safest max effort, that hand isn't helping it drive into a deeper stretch. You're only doing it through the musculature of the knee, not with the assistance of the hand. We're not trying to hurt ourselves. We're not trying to cheat. If anything, the hand that's originally a block for the PAILs contraction stays where it's at in space, and you use it as a marker to pull away from, if that makes sense. All right. So hand maintaining internal rotation of the tibia, other hand on the outside of the knee, feeling for that muscular contraction of the outside leg stuff to contract when we do our PAILs. So now that we've been here for a minute, 10% effort, externally rotating the tibia, hand is meeting its resistance, 20%, 30, make sure it's not just coming from the ankle, try and have it come from the knee tissue, 40, 50, 60, 70, 80, 90, 100% safest max effort, drive, 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 drive. Tibia is rotating externally as hard as you can. Hand is blocking its movement for another 5, 4, 3, 2. Hand stays there. Internally rotate that tibia as hard as you can. 100% safest max effort, drive, drive, drive. Internally rotating that tibia. Taking my hands, placing it on my lower leg, trying to externally rotate my tibia gently as I fight against that to kind of feel a deeper sensation on the inside of the knee. Drive, 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 drive. 3, 2, 1. Place that hand back on as a block. See if you can get into your new end range and relax. Tibial rotation is something that is never really trained for most people. So if you're having a hard time connecting with the musculature and the neurological connection, totally normal. Keep practicing. This is a skill set that's learned over time, and you'll get there eventually. Again, make sure you're doing your knee cars beforehand and give yourself a good little knee car, 2 in each direction after. And switch sides.